Welcome to Health Code Blueprint. Today, we'll review coding scenarios designed to reinforce accurate ICD-10-CM code selection using the official guidelines for Chapter 5, Mental, Behavioral, and Neurodevelopmental Disorders. We'll walk through provider documentation, apply the ICD-10-CM guidelines step by step, and explain the clinical and coding logic behind each final code assignment. Disclosure: this presentation is intended for educational purposes only. It does not constitute legal, compliance, or billing advice. Always refer to official ICD-10-CM guidelines, organizational policies, and regulatory requirements when making coding decisions. Alright, before we jump into the cases, let's talk about what really drives Chapter 5 coding. Unlike physical conditions where we can rely on imaging or lab results, mental and behavioral disorders require us to look behind the diagnosis. We're always asking three big questions. First, what's the origin? Are we dealing with something physical, something psychological, or something the patient is intentionally creating? Second, is this current or historical? Is the behavior happening now, or is it something from the past, like remission? And third, what's the intent? Are the symptoms real to the patient, or are they being produced on purpose? Once you understand these three elements, the rest of Chapter 5 starts to make a lot more sense. Let's look at our first case. Psychological pain is one of those diagnoses that really highlights how different Chapter 5 can be. Clinically, psychological pain means the patient is experiencing real physical symptoms, but the cause isn't physical at all, it's emotional or psychological. In this case, we have a 38-year-old male with severe back pain. All the tests come back normal: imaging, labs, neuro exams, everything. And the provider documents that the pain is entirely psychological. So now we have to decide: do we code the pain site, or do we code the psychological origin? Here's where the exclusively rule comes in. When the provider clearly states that the pain is exclusively psychological, ICD-10-CM tells us exactly what to do. We do not assign physical pain codes like G89. Instead, we go straight to F45.41, pain exclusively related to psychological factors. This code tells the real story. Yes, the pain is real. But the cause is psychological, not physical. Now let's move into a scenario where both physical damage and behavioral history matter. Clinically, substance-related disorders in remission describe someone who used to have dependence, but the behavior has stopped, even though the physical consequences may still be present. In this case, the patient comes in for follow-up. The provider documents two things: alcoholic cirrhosis, the physical damage. Alcohol dependence in remission, the behavior has stopped for 4 years. So we have a body that's still affected, but a behavior that's no longer active. To capture the full picture, we need two codes. First, we code the physical condition. K70.30, alcoholic cirrhosis of liver. Then we code the behavioral status, F10.21, alcohol dependence, in remission. And here's a quick reminder. We don't use F10.288 unless the provider specifically documents other alcohol-induced disorder. Remission has its own dedicated code, and it takes priority. Alright, let's look at our third case, and this one is all about intent. Clinically, factitious disorder is when a patient intentionally produces or falsifies symptoms, not for money, not for legal reasons, but because of an internal psychological need. In this scenario, we have a 29-year-old female reporting severe abdominal pain and claiming multiple past surgeries. But again, labs, imaging, exams, everything is normal. And the provider documents that she is intentionally fabricating symptoms. This isn't psychological pain. This isn't somatoform disorder. This is deliberate symptom creation. So once intent is documented, the coding path becomes very clear. We assign F68.12, factitious disorder imposed on self, with predominantly physical signs and symptoms. This code captures the key factor that separates this condition from others. The symptoms are being intentionally produced. Alright, so at this point we've walked through three very different scenarios: psychological pain, substance-related remission, and factitious disorder. And honestly, Chapter 5 becomes so much easier once you realize that almost every case falls into one of these three buckets. Think of it like a quick mental sorting tool. When the symptoms are real to the patient but the cause is psychological, we're looking at F45.41. When the physical damage is real, but the behavior that caused it has stopped, that's your K70 plus F10.21 combination. And when the symptoms are intentionally produced, that's when F68.12 comes into play. This little matrix gives you a shortcut. A way to quickly orient yourself before diving into the details. Once you know which bucket the scenario fits into, the coding path becomes much clearer. Chapter 5 really pushes us to look beyond what's written on the surface. We're not just capturing symptoms, we're interpreting behavior, intent, and the true origin of what the patient is experiencing. Our role is to take the provider's documentation and turn it into codes that accurately reflect the full clinical picture. Thanks for watching Health Code Blueprint. See you in the next video.